Welcome to Learning Thursdays. I'm Dean Hale with the OASAS Learning and Development Unit and your host for today's presentation. Today's presentation is titled OASAS Credentialing Updates, the new credentialing management system, credentialing of addiction professionals, regulation updates, and updates to credentialing complaints, process, and information. And our presenters are Dr. Chinazo Cunningham, Commissioner of New York State OASAS, and from the OASAS Credentialing Unit, Rebecca Cooper, Credentialing Unit Manager, Tracy Schaefer, Credentialing Specialist Supervisor, and Colleen Stanek, Credentialing Administrative Supervisor. They will be joining us in just a moment. First, a word about Learning Thursdays. Learning Thursdays are offered to behavioral health professionals as a free learning opportunity with the goal of improving the knowledge and skills of the New York State substance use disorder workforce as we strive to improve the lives of individuals needing prevention, treatment, recovery, and harm reduction services. A goal of Learning Thursdays is to support the professional development of the treatment, prevention, recovery, and harm reduction workforce. We do this by offering regular presentations that are relevant to today's substance use disorder treatment professional. As always, if there are any questions, comments, or suggestions, please feel free to contact us at the Learning Thursdays mailbox. You can use the same mailbox to express an interest in providing a future Learning Thursdays program. And now it's time to start the presentation and welcome our guests.
Good morning on this nice fall day. I'm Chinazo Cunningham, the Commissioner of OASAS, and I'm just going to open up this webinar saying a few words, and then I'm going to hand it over to Rebecca Cooper. So thank you so much for joining today. I think, as you all know, we're at the worst point ever in terms of this overdose epidemic. And in fact, just this morning, woke up to news announcement from New York City saying yet again, worst number of overdose deaths ever on record for New York City most recently. We also know that a lot of the work that it takes to address this epidemic really has to do with the workforce. And we know that there's a huge shortage of the workforce and that the workforce is exhausted. We also know that really a lot of the greatest need to address this epidemic is the frontline workers, which includes really the CASACs are crucial as part of that frontline staff. So to assist with the recruitment, retention, and professional development, we have been working very hard on several initiatives to support the workforce. And so part of that includes the Part 853 credentialing regulations that you're going to hear about, in addition to the over $9 million of scholarships for CASACs, the certified prevention professionals, and for SERPAs. So today, we're going to be talking about the credentialing regulations that will really help to support, expand, and retain the workforce. And, I've in many conferences, meetings, and some town halls across the state have heard from all of you about really the concerns of the workforce being one of the biggest barriers and challenges that we face every day. And so I think there's not a single meeting that I'm at that the workforce issues don't come up. And so, I'm very happy that I think that some of these improvements in the credentialing process will make it easier for people to apply for and to renew and reinstate their credentials. As I mentioned, about $9 million in scholarships have been announced for education and training for people to provide addiction services. And then we anticipate that there will be additional awards like this in the near future. So some of the highlights to the changes of the Part 853 credentialing include the creation of a new CASAC provisional certificate, and that's really to assist the workforce in hiring and retaining bachelor level and master's level people while they're working for towards their full CASACs. It's allowing both the CASAC T and the CASAC P, the provisional, certificate holders a one-time 3-year extension to fulfill all of the CASAC requirements. We're also now accepting checks for the initial application, whereas previously before it was only money orders or cashier checks. We're also starting the 5-year clock on obtaining a credential from the initial review instead of the postmark date of the application. We're updating the one-time training requirement to include harm reduction, person-centered care, opioid overdose prevention, screening for suicide risk, and cannabis use disorder. We're simplifying the renewal process that allows for attestations of professional development hours and ethical conduct. And we're allowing reinstatement of a credential for those whose credential has expired and are interested in obtaining it again or re-entering the field of addiction. So in addition, another improvement is the online credentialing management system that will allow all credentialing processes and communications to occur through a secure online portal. So that's, fantastic to bring us into the 2020s. So no longer will people need to submit paper applications and supporting documents. This will also allow for direct communication with the credentialing reviewer for any questions. Clearly, it'll be a more efficient experience for both you all and for our credentialing unit staff. And payment can be submitted through the online portal instead of mailing, the money orders or checks. So also just want to touch base on some of the initiatives that we have to support and expand the workforce. So this includes the Workforce Development and Fellowship Program that's at 4 medical schools, and that will support 83 New York State fellows with healthcare experience to gain educational training to meet the need for New Yorkers with addiction. And this includes, social workers, nurses, nurse practitioners, physician assistants, physicians, so the whole range of those who can then, have fellowships to be trained in order to really meet the needs of people with addiction. And then the addiction professional scholarships, which I had mentioned earlier, which allows a person to take the 350-hour course for the CASACs or the 50-hour course for the SERPA, or both, along with an internship to develop skills and gain experience in the addiction field. Scholarships also pay for application or registration fees that are associated with courses at community-based organizations. And I've definitely heard from community-based organizations that, funding these programs are really an important part of having like a direct path for providers to be able to develop the staff and then to keep them in order to fill vacancies and add positions. Scholarships through the Empire State College include scholarships for bachelor's degrees in addiction studies, and this is obviously important so that people can then apply for an advanced or master CASAC, so we can expand the pool of clinical supervisors. And we're also developing a process to assist payment for credentialing or exam fees, and more information on that will be posted soon on our website for credentialing. So that's kind of just really an overview of some of the changes and initiatives that we are funding and supporting. And again, really trying to do a lot of work here to support the workforce, because we've heard very clearly from all of you in the field about the need to really support and expand the workforce. So I appreciate all the work that you're all doing. I know that the last 3 years have been exhausting. And at the same time, we know that the overdose epidemic continues to worsen. And so we need to keep all the people that we have and support them in the front line, and to continue to expand those who come into the field of addiction. So thank you very much. And thank you for joining us today. And I'm going to hand it over now to Rebecca Cooper, who's the OASAS Credentialing Unit Manager, so that she can give you more details about some of the things that I spoke about.
Great. Thank you, Commissioner, for your remarks, and we certainly appreciate you prioritizing the expansion of the addiction workforce. We've been very, very busy, as you said, but we're really happy to finally be able to unveil all of these changes today. One of the things that we obviously had to do was update the regs and go through the whole process to do that, and we have to put together this kind of highlights for the governor's office. And, one of the things they ask is, is there going to be any issues with this, any challenges with this? And I think we're able to say no, because this is really helping, you guys in the field really expand the addiction workforce. So we're excited about that. Before I sort of move into the slides and introduce the other two staff that are going to be working with me on this, I just also really need to thank several other people in OASAS, because especially on a project like this, nothing is ever done in a vacuum, and I'm remiss if I don't recognize some of our other OASAS colleagues. We actually worked with colleagues across all divisions in OASAS to make all of this happen, which is always exciting to me, to be able to collaborate like that. So I'd like to thank everyone in the agency who has supported us. Especially, I just want to give a shout out to Grace Kelly and Counsel's Office, who coordinated all of the legal pieces of this, and recognized the training unit, who we worked very closely with. Robert Wright is the director of that, and Dean Hale, who you can see. I think we can still see Dean. He's coordinating all of this for us today. And I also will give a special shout out to Elle Etchison, who is our digital and media services point person. She did all the updates on the website this weekend and last night. So we certainly appreciate that. So the other thing that I wanted to just mention before we move on is that this is being recorded, and it will be a Learning Thursday. So those of you that are on that want to get your credits for that, just keep in mind, sort of make a little note, and in about a week, if you go to Answer Key, the questions will be posted, and the certificate, so that you can get hours for this. I already kind of did a welcome and overview. I also wanted to say that we will entertain some questions in the chat at the end. We'll probably only have time to answer a few questions, but our plan is, once we get rolling on this, we will have a fact sheet and a Q&A that will be posted on the credentialing website. So we want to sort of get an idea of what your additional questions are as we get going. So this, I think, is important. This is the credentialing unit staff. We were recently had a staff retreat back in June, because as you'll see as we roll through this, we have been working really, really hard with lots of changes. So we had a retreat, and this is the staff. I have been at OASAS for 18 years. I've been the manager in credentialing for 2 years, and I have to say we're a mighty staff of 14, and everyone is very dedicated, hardworking, caring, and it's been a real pleasure working with them, and everyone has given 150%. So I certainly appreciate them. All right, so like the commissioner mentioned, one of the exciting projects that we're diligently working on is finally an online credentialing management system, which will definitely move us into present day. I think all of you know and are frustrated with mail and the processing times. On our end, we get bins and bins of mail that have to be manually opened and stamped and delivered and scanned. And, oftentimes mail is touched like 6 or 7 times before it actually gets to a reviewer, which is definitely not efficient. So we did a procurement for an online management system. We're currently working with Prutech, who is our contractor, and I will give a shout out to Mark Jeanette. Luckily, Julia Fesco who is my boss, had the foresight to say, hey, we're going to need someone to coordinate all of this. And I'm really glad she did. And so Mark is our project manager on this. So it's going to be an online credentialing management system. Will be online for everything. So no more pencil paper, no more mail, no more spending $25 overnight to get you our stuff on time, your things to us on time. And so everything will be done through there. You'll be able to submit your application. You'll be able to do your payments. We will be doing review summaries, and the review summaries, and we are no longer calling them deficiencies because we do listen, and we've had lots of conversations with lots of you, and we're paying attention to our language. And deficiency is very negative, so we're changing the language to review summaries. You'll receive review summaries through the portal. And it will be done through a secure online login through ny.gov. And, once you set up your initial account for that, everything, should run very smoothly. And you'll also, the commissioner did also mention this, but this is one of the things I'm really excited about, and I think that the team is excited about too, is that you'll be assigned to a reviewer, either an initial reviewer or someone for renewal, depending on what you're submitting, and you'll be able to communicate directly through your portal with your reviewer. So no more need to email the credentialing mailbox, and we have to sift through and find out who it needs to go to. So there'll be a back and forth dialogue that you'll be able to have with your reviewer on any questions or things directly related to your application. So we anticipate that this will be ready, hopefully by the end of this year. We'll launch this. But in the meantime, I wanted to just give you a few heads up, and we'll be communicating a lot to get ready for this and let you guys know where we are in the process. But so if you currently have a credential with us, or you have an application currently submitted, your information is going to be automatically migrated to the new CMS, which means you don't need to do a thing. But what you will need to do is set up an account, and we'll be communicating a lot to let you know when to do that, how to do that. So when you actually log in, all of your information will already be there. And again, we will provide more information about the launch and what that's going to look like as soon as we know. The most important thing that we ask that you do is make sure that we have your right email address. If you changed emails or anything like that, please let us know, because all of our communication with you is going to be done through email, through the portal. So you'll get like an email directly from the portal that says you have a notification or a communication, please log into your portal. So we just ask that you ensure that we have your correct email address. Okay, one of the other things that we will be doing, and this is something that we get a lot of questions through the credentialing mailbox, trying to verify someone's credential, that kind of thing. So what we'll be doing with the new system is, and on our website, is that we'll be combining the credentialing verification page and the misconduct pages. So everything will be on one screen when you type in someone's name. So we think that'll be much more efficient and help you guys get information that you need more quickly. We also will be adding in the status of someone's application. So we get a lot of questions about, have you received my application, or if you're interviewing someone and want to find out the status, if someone has submitted an application, that information will show up on this verification page, so you can see the date that it was submitted and as it goes through the process. And then once the credential or the certificate is issued, it will sort of be a timeline that you'll be able to see online. The other thing that will happen is currently right now on our misconduct page, we only list people that have had their credentials revoked. We will also be adding the suspensions to the verification page. And we also will be listing the specific canon of ethical principles that was violated will also be listed on there as well. Yes, okay. So I want to introduce two other people in the credentialing unit who help keep the ship moving. Colleen Stanek, who's the administrative supervisor, and Tracy Schaefer, who is our credentialing review supervisor. And they're both going to take over and share, kind of going into more of the details about the reg and some of the other updates we have related to the complaints and Justice Center reporting. So, Colleen?
Thank you, Rebecca. Good morning. So with this slide, when a complaint decision results in a suspension or revocation, the agency in which the incident occurred will be notified of that decision. Also, there is a new 1-hour mandated professional training, a Learning Thursday, which is related to professional boundaries and the reporting requirements. This training is also going to be part of the 15 hours of ethics trainings that are going to be required.
Good morning, everyone. This is Tracy Schaefer. Some of you may know my name. I've been in credentialing since 2008. So many of you, maybe I was your reviewer back in the day, and maybe you're able to finally put a face with the name. Thank you for, coming and listening to our webinar today. As the commissioner said, one of the most exciting things is that we are now accepting personal checks, no longer having to go out and get a money order. So that is definitely a highlight of some of our changes. Another thing is that you will see in the applications, we now have an attestation for a preferred first name. And that is going to be really allowing us to be more personable with you, especially when we have the new database in CMS. We will be able to communicate with you. Your reviewer will communicate with you. If you submit one of those attestations, your reviewer will be able to communicate with you using your preferred first name. Also, over the years, we found that folks were going in and doing the Learning Thursdays using a first name that maybe wasn't what they submitted their application in. And so this attestation allows for you to be able to continue doing that. It does, however, not apply to any legal documentation. It won't, your preferred first name will not be on any issue certificates or review summaries. It is really just a way for us to be more personable in communicating with you. The commissioner did mention this next bullet that we are the 5 years in initial application does start. It has previously started with the postmark date, and moving forward, it will start with the date that the reviewer picks it up and reviews and sends you out a review summary. This was an important change because, as you all know, during the pandemic, it did cause us to have quite a backlog, and that cost folks time, in their application process to gain their work experience. So this was an important change and an exciting change. One of the things that changed in the reg is we don't specify the one-time requirements anymore. We previously, you might know, we had the 4 hours of tobacco that has since been removed. The one-time requirements are to ensure that we're flexible in the areas of as the field continues to evolve and the agency's initiatives change. We want to make sure that the one-times are reflecting that, especially later on when I talk about reinstatement and folks coming back into the field. So let's talk about the CASAC provisional, which is what half of you are probably here to hear about. So this is very exciting because the CASAC P, which I'll say right off the cuff, is that it is identical as far as it's the equivalent to a CASAC trainee. So, there's no need for folks to have both. They are exactly the same in our scope of practice. It's just that the way that one obtains a CASAC P is different than the CASAC T. And so in order to get a CASAC P, you have to have a bachelor's or a master's in a human services field. when someone decides that they're going to pursue the CASAC-P in the CASAC and they send in an application, they will need to submit a transcript so that we can review and get you, and I give you an idea of at least what you have as far as the 350-hour education requirement. Even though you don't need that for the P, it will give you that first review to let you know what you need and so that you can start working on it during that 5 years. You do, however, need the mandatory one-time requirements to obtain your CASAC-P. And we've made that really simple for folks. There is a link out on the training catalog right underneath CASAC Initial. There's a drop down. You can go right on there, click on a flyer. There's links to every one-time requirement training, and there's even little check boxes as you complete them. One of the things that is most important when you want to pursue the CASAC provisional certificate is that you need to have there's a form in the new CASAC application you will see. It is a verification of employment or letter of intent to hire. This form must be completed by your potential or your current employer, which is an OASAS certified treatment provider. It must be completed and submitted with your application. If it is not submitted with your application, you will be considered for a CASAC-T. Your application will be processed that you're pursuing the CASAC. When you meet the requirements for the T, you'll be issued the T. If you currently are an applicant and you fall under the previous regs prior to today, and you have not been issued a T, you can submit that form that I'm referring to that is in the new application, and you can be considered for the CASAC-P. And again, as I said before, I kind of was filling it in the other slide, is that the T and the P are exactly the same according to the scope of practice. There's no need to have both. One is not better than the other. It's just in how you obtain it. The other thing that the new regs have brought back that we previously had is that you will be eligible. If you're exam eligible and you hold a CASAC-T or a P moving forward and you're exam eligible, you will be eligible for a one-time 3-year extension on your certificate.
Tracy, I just want to add in one quick thing before we go to the next slide. Related to the CASAC provisional, I just want to give an example of some of the things that we've heard from you related to hiring and obtaining people. So this would be a great example if you have an intern in your that's working in your program and they're going to graduate and they're working either on their bachelor's or their master's degree. It would allow you to retain them, right? So so that they could stay and you could hire them, to be able to stay in your program if you wanted to, keep them on without, and the CASAC provisional review, as long as everything is submitted and it's complete and then the turnaround time for the review is going to be relatively quick. So that's another thing we just want to try and assist with having the appropriate staffing that you need.
Thank you, Rebecca. And just to piggyback that, you will need, as in the T, you will need to have a background check when you become eligible. I just wanted to make that clear. So let's talk about updates to renewal. Very exciting, especially for our reviewers. You will no longer need an evaluation when you renew your credential. However, you will need to sign an attestation that you had adhered to the canon of ethical principles and misconduct during your prior 3 years of being credentialed. In addition to that, there's an attestation for the 60 hours of education and training. So you will no longer have to submit your certificates. You will just sign the attestation that you completed the training. However, we will be holding random audits of those attestations, so you should be aware of that. And the late renewal fee is now a $50 flat late fee. Regardless, if you're 1 day late up to a year, it's $50. So this week is going to be the first 120 day mailing under our new regs. So this is kind of exciting. I know the renewal reviewers are looking forward to this. So this will go out this week. If you were part of the previous 100, and if you're CASAC or credentialed, and you were part of the previous 120 day mailing that went out, you can request a new application and follow the new regs. But if you're in late renewal, you will have to follow the previous regulations. Reinstatement is back. So the last regs, we had reactivation and inactivation, reactivation. We have brought back reinstatement, another effort to try to bring people back and make it easier for folks to come back into the field. If you've been expired more than 1 year, you're eligible for reinstatement. Just as in regular renewal, you do have to sign an attestation for the Canon of Ethical Principles and the Justice Center Code of Conduct. You are required to complete, for CASACs and CPGCs, you are required to complete 75 hours of mandated training. These are very specific trainings that, as Rebecca mentioned earlier, it was a agency-wide collaboration with other units, with the medical director, with trying to come up with trainings. So if somebody had been out of the field for 10 years, we want to make sure you come back into the field, knowing what the current trends are, the current agency initiatives, and making sure that we have well-rounded counselors coming back. And that's 70 hours for the CPP CPS. Again, we've made it very easy for you. There are links out on the training catalog so that you can go out. It sounds like a lot of training. They're specific trainings. There are links to each one of them. You click on them and just take the trainings. You do have to, for reinstatement, send in the actual certificates of completion. You do have to go through a background check, and there is a $400 application fee. If you hold a dual credential, it is $500.
Good morning. Again, this is Colleen Stanek. With these new regulations, there is an addition to the misconduct guidance, and that reads, initiating or pursuing a romantic, sexual, or otherwise sexually exploitive relationship or committing sexual misconduct with a service recipient or former service recipient using romantic sexual comments or touch, romantic sexual contact in written, telephone, or electronic format, including but not limited to social media, text messaging, email, photos, videos, or recordings of a romantic or sexual nature. With this addition, there is an updated complaint form, which is available on the website, or it can be requested by emailing us at the credentialing unit.
I want to thank our guests for today's program. I hope you will all find it useful while assisting clients in need of services. Your feedback is important to us. It helps us to know if we are meeting your educational goals and expectations. Once you have viewed the presentation in its entirety and completed the quiz, if prompted, please follow directions to access the SurveyMonkey website and take a moment to complete the evaluation. Once again, thank you for joining us and keep up the good work.